Hi, we're going to do the humerus now. And one problem that I have is determining whether this is a left or right humerus. So I have to go actually to the most distal end and look at it from there. And at the most distal end, you'll notice that there's a bit of a divot right here. This is actually where the olecranon fits into for your elbow joint. So I know this is the posterior portion. That would make this the anterior surface of the humerus. Now we can start identifying our landmarks. This top part is the head of the humerus. It's not as big as or distinct as the femur. You can see the difference between the head of the humerus and the head of the femur. This is a true ball, and this is just a little bit part of one. But it still works, and the head fits in to the glenoid fossa like that. There's an anatomical neck, which actually makes a line like this. But when you have a fracture of the head of the humerus, it's normally, or the neck, it's normally, this is the surgical neck, and this would be the anatomical neck. So this is where they would do a replacement. They wouldn't follow along the line of the anatomical neck. On the most lateral part is a tubercle called the greater tubercle. Medial part is lesser tubercle. You can palpate those on yourself, but it is a little bit hard because there's a lot of muscle and tissue around this area. But you can usually find the groove that goes in between the two, and this is where the long head of the biceps tendon travels, and you can see that this is just a good spot for a tendon to travel. This is actually called the bicipital groove. A little bit further down, about a third, not quite halfway down on the shaft of the bone, and it's hard to pick up on the plastic models, but there is another little tuberosity down here, and it's called the deltoid tuberosity, where all three deltoid muscles attach so that the humerus can do its motions. So you have the head of the humerus, you have the greater tubercle, the lesser tubercle, bicipital groove, anatomical neck, surgical neck. I think that's it.